We'll go from asthma to our next client, EC, who has emphysema. Let's review a little about emphysema before discussing this client. Emphysema is a chronic disease in which the alveoli, the tiny air sacs in the lungs, are damaged and become overinflated. It's characterized by airway resistance and decreased diffusing capacity. Emphysema is one of 3 constellation diseases that comprise chronic obstructive pulmonary disease, or COPD. Do you remember the other 2? Asthma and chronic bronchitis. That's right. The risk factors for emphysema are smoking, exposure to environmental pollutants, antitrypsin deficiencies, family history, and increasing age. When you see EC, you'll want to compare his symptoms with those that are characteristic of emphysema. What would those symptoms include? Cough with thick sputum, wheezing, difficulty breathing with activity, weakness, and lethargy. When you examine EC, what would you expect to find? Increased anterior-posterior chest diameter, use of accessory muscles for breathing, asymmetrical thoracic movements, decreased diaphragmatic excursion, pursed lip breathing, ruddy skin color, and clubbed fingers. The last time EC was here, he had to lean forward on a table to facilitate his breathing, so you'll want to see how he's doing now. When EC was diagnosed based on history and physical, the physician ordered a chest X-ray, pulmonary function tests, and our arterial blood gas analysis. Do you remember what pulmonary function tests might show in someone who has emphysema? Generally, you'd expect to see a prolonged forced exhalation, decreased vital capacity, and increased residual volume. Let's discuss EC's treatment. The first step was to get him to stop smoking. It was difficult for him, but he did it. He uses a humidifier at home and takes a bronchodilator. He also went through pulmonary rehabilitation, where he learned how to breathe correctly. Sometimes he uses oxygen, but not all the time. If he gets a cold, he takes prednisone. And of course, if he gets a respiratory infection, we start him on antibiotics right away. EC's done really well with his management plan. He monitors his respiratory status well and avoids exposure to smoke and other air pollutants. You'll see a lot of clients with COPD, so many in fact that we keep a chart nearby that outlines the key points to remember. Let's go look at it now. COPD overview. COPD is a chronic progressive group of obstructive airflow diseases, including asthma, chronic bronchitis, and emphysema. It results in increased airway resistance and causes permanent lung distension. Risk factors include cigarette smoking, chronic exposure to pollutants, chronic lung infections, and genetic predisposition. Signs and symptoms are dyspnea, which begins with exertional and progresses to dyspnea at rest, wheezing, crackles, productive cough, orthopnea, intolerance to exercise, tachypnea, tachycardia, increased anterior-posterior chest diameter, use of accessory muscles for respiration, cyanosis, hypoxia, and peripheral edema. Diagnosis is based on history, physical examination, pulmonary function tests, ABGs, CBC, pulse oximetry, chest X-ray, and bronchoscopy. Client and family education encompasses effective breathing techniques, oxygen administration and safety measures, positioning for maximal ventilation and to mobilize secretions, respiratory exercises, postural drainage techniques, the importance of adequate hydration, measures to help with smoking cessation, signs and symptoms of hypoxia, secondary to infection, use of medications and inhalers, avoiding extremes in temperature and humidity, the importance of immunizations for influenza and pneumonia, and a low-carbohydrate, high-protein, high-fat diet. Pharmacotherapy includes immunizations, antibiotics, bronchodilators, corticosteroids, oral and inhaled, oxygen, and beta-adrenergic agonists. Complications include respiratory insufficiency or failure, pneumonia, atelectasis, pulmonary hypertension, pneumothorax, congestive heart failure, and acute respiratory distress syndrome. This chart is very comprehensive and follows a flow sheet that guides us in assessing each of these areas with each client at each visit. This flow sheet remains in the client's chart. The nurses here are determined to provide clients and their families with comprehensive education and to monitor how they're doing. Often it's the nurse's assessment of how the client's doing that alerts the physician to a problem.